Don Weber, and I am Chief Executive Officer for Syncardia Systems. We are a medical device manufacturer. We specialize in the world's only total artificial heart. It replaces the human heart, temporarily to allow the patient enough time to receive a donor heart. So medical research right now, today, is funded through a few different ways. One, government. The government can allocate a certain amount of money for research, and they do. They dedicate a lot of dollars, of course, to even COVID and other diseases and viruses, so on. But probably the number one way to do or fund medical research today is really through venture capital. So you've got private investors that decide to get together as a group and make an investment into a company, and of course hope that technology works the way that they believe it will, and that they can then turn around and sell it for a profit. I guess in an ideal world, I would not want medicine to be funded by private investment. I'd want it to be funded by the people, by the government. But then again, when you do that, there's a trade-off. You take away, your liberties. You have other people making decisions for you, and I get that. There's a balance, but the reality is the way our healthcare system works today is that it differentiates between the rich and the poor. If you're wealthy enough, you're going to get the insurance and you're going to get the health care that you need. If you're poor, you may not even have medical insurance, and therefore not even be able to have access to the treatment, which is not the way I believe healthcare really should be approached. The cost for medical insurance alone continues to go up. 30 years ago, your private insurance premiums would go up on average a few percentage points, single-digit percentage points every year. We're now at a point where we're almost always double-digit year-over-year increases, and I believe last year it was over 18%. So it just continues to get higher and higher. It's not sustainable. In the United States, compared to other countries, we are probably ranked in the 40th percentile, meaning we're not very good. We're not very efficient. We have the best health care anywhere on the planet. And if you're sick and you live in China, chances are, and you're wealthy, chances are you're going to get treated in the United States at one of our healthcare facilities. We have the best research, best hospitals, best teaching facilities, and the most innovation. We put so much money into innovating new products. But the reality is the cost of administering the healthcare, that insurance program, is just not sustainable. It's incredibly expensive. It's incredibly complex. Very few people actually understand, the entire reimbursement insurance process itself, and it is very, very costly compared to other countries, especially countries that practice socialized medicine. The United States is not very good. We're ranked very, very low. There's really no other modern contemporary country that has such division amongst the classes when it comes to healthcare.
My name's Layla. I work as a care coordinator at a startup called Included Health. As a care coordinator, I help my members with any and all questions they have related to their health. But at our startup, we focus on helping the LGBTQ community, and we basically help them get the care they need or understand their insurance plan and get their coverage that they need. A couple of examples of what I do as a care coordinator is a member can come to me and say, I'm looking for an LGBTQ-friendly doctor who can prescribe PrEP. PrEP is a drug that is used by gay men, and it's a sexual related drug. So I will call a bunch of providers. If they live in a rural part of the U.S., it can be really difficult to find a doctor who even knows what LGBTQ stands for. So oftentimes we'll call a bunch of doctors. We'll only accept some of them who we feel would be compatible and capable to treat our members. And it's really important that the doctors that we call are accepting and understanding of the needs of the LGBTQ community. We are the first startup, I would say, that does what we do. There are currently 5 employers that offer this benefit, so we are part of the health benefits of an employer, and we don't really know any other company that's doing what we do. So we have a lot of members who are in need of our help that we need to reach. I'm currently taking care of 24 members just today. In a week, we reject probably like 50 doctors on average, just either by their responses in regards to the LGBTQ community or because of reviews on the internet about either it's poor reviews or reviews from like other members in the community. Just from like a medical school standpoint, they don't spend enough time teaching. I think there's like one lesson on trans health and like LGBTQ health. We get a huge range, ranging from people who are looking to transition from female to male or male to female to just someone looking for a physical therapist or a dentist. I would say surgeons, specifically trans-related surgeons, are definitely the most scarce providers. There are an array of transgender-related surgeries, and a lot of our members come looking for providers such as those, and I've had members who, in their entire state, there's not even one single surgeon who does the surgery that they needed, and therefore they had to fly out of the country just to get the simple surgery that they needed, and it was during COVID, and it's super costly to face all of those barriers. And most other people, if they're going for just a general hysterectomy, just any type of surgery, there are a plethora of doctors who can provide that service for you, but trans surgeons are just so limited, and that's large in part because transgender surgeries aren't seen as important and as vital as other surgeries are. I think we're at the early stages. There are still a lot of states that don't even fully accept that, and people in our Senate who want to repeal that. We have to dig for doctors who even know about them and would be competent to treat them is a huge. One day we can at least say that everyone has access to health insurance. I feel like that's not asking for too much. I want to get to the point where my job is not needed, and that a role like this is obsolete. I think the fact that there's a position like mine is really sad. Hopefully one day my company won't be needed and I won't have to do this type of work anymore because the systems in place will be sufficient and competent enough and able to offer all types of people coming from all types of places the care that they need.
In light of the American healthcare system being for profit, 1 in 4 Americans are skipping medical care because of cost. One family shares their story.
My full name is Jerry Ramirez. I live in El Paso, Texas, and I am 14.
My name is Andres Ramirez. I am 18 years old.
The doctor from our hometown diagnosed me with a hemangioma, and they said that we don't have nobody here that specializes it in the department. So we were transferred to San Antonio, and every 6 months we go to experience it and have new doctors come every time and see what's with my arm. It is called a hemangioma, and I was diagnosed with it the day I was born. What it is just a bunch of blood vessels compiled together, which can create this bruised sort of color. It's nothing really dangerous, except if it gets to some nerve points in your body. So for example, mine is in my elbow, so if it touches my elbow nerve, then I could have a possibility of losing my elbow nerve system. So it's kind of scary too.
Well, of course, when Jerry was born, everybody was excited. We had a new family member coming in. When my mom, Birdie, gave birth, she saw the tumor, and I remember it being very purple, it was noticeable, it was frightening.
They started telling me that it was growing with me and if it can touch my arm, then I could lose my arm nerve system, which could make me disabled on my left arm.
It affected us financially with all those medical bills because they kept asking for Jerry to come in to go get checked up. And it wasn't just a regular checkup. It was always being analyzed, scanned, all these different procedures.
They had to do surgery, a 3-hour surgery procedure, to take 80% out of it. And now over time, when I last visited them, they said that more skin has grown on it and it's growing with me.
There was times where it was either paying the house or paying Jerry's expenses, so he can keep seeing all these doctors and specialists to try to help him. Right now we are struggling because of this pandemic. I know my mother last time had to cancel our last appointment to San Antonio because we didn't have the financial, we weren't financially stable. This appointment that my brother just went to, it was rescheduled. It had been 6 months already. Jerry missing an appointment is very dangerous because in those span of 6 months and half a year, you never know if the tumor will grow 2 inches, 2 centimeters. You never know if it can become cancerous. So him missing that appointment is very risky. But it's something that we had to decide to do because at that time we didn't have the money to be able to go over there to pay for a hotel, for the food expenses, and for the gas.
This family isn't alone. As healthcare costs continue to rise in the United States, more people are at risk of refusing to seek medical attention.
No one should be charged going to the hospital after life-threatening injuries or something they were born with. Example for my brother. It's no one's fault that these things happen.